Dear students, welcome to my channel Astropharma. Today we are going to discuss about the thyroid diseases. So in thyroid diseases, we are getting following diseases: hyperthyroidism, hypothyroidism, in that one cretinism, myxedema, thyroiditis, Graves disease, which is also caused as a diffuse toxic goiter, then diffuse goiter, nodular goiter. So we will go on discuss one by one. The first one, hyperthyroidism and hypothyroidism. So hypermetabolic clinical and biochemical state caused by excessive production of thyroid hormones, more frequent in females, associate with rise in both T3 and T4 levels in blood. T3 is more than T4. Then etiopathogenesis. Three most common causes for the hyperthyroidism are Graves disease, which is also called as a diffuse toxic goiter, toxic multinodular goiter, toxic adenoma. Other less frequent causes are hypersecretion of pituitary thyroid stimulating hormone by a pituitary tumor, hypersecretion of thyrotropic hormone, thyroiditis, metastatic tumors of the thyroid, HCG secreting tumors, which occurs in the choriocarcinoma testicular tumors, excessive doses of thyroid hormones or iodine called Jod-Basedow disease. Comparing to hypothyroidism, hyperthyroidism with hypothyroidism, inadequate production of thyroid hormones. So hyperthyroidism is excessive secretion of hormones, whereas hypothyroidism are decreased secretion of hormones. Which hormones? T3 and T4 hormones, thyroxine and thyronin hormones. The clinical manifestations are depending upon the age of onset of disease. For the hypothyroidism, two forms of hypothyroidism. One is cretinism, which is also called as a congenital hypothyroidism, which is observed in infants and children. And second one is myxedema, that is observed in the adult. Next, clinical features of hyperthyroidism: slow and insidious onset, emotional instability, nervousness, palpitation, fatigue, weight loss in spite of good appetite, heat intolerance, perspiration, that means more sweating, menstrual disturbances, then fine tremors of the outstretched hands. So these are the clinical features of hyperthyroidism. Then coming to cardiac manifestations of hyperthyroidism, that means these are the symptoms which are observed in the serious issue of hyperthyroidism. That is tachycardia, palpitations, cardiomegaly, then skin, warm, moist and flushed skin, then weakness of skeletal muscles, very important, osteoporosis, typical eye changes, exophthalmos, common feature in Graves disease, hyperthyroidism which is common is Graves disease, serum levels of T3 and T4 are elevated, thyroid stimulating hormone secretion usually inhibited. As the T3 T4 hormones levels increases, TSH hormones level secretion decreases. Hypothyroidism, two types, cretinism and myxedema. So these two are the hypothyroidism. We are go on discussing by comparison. First definition, cretinism. A cretin is a child with severe hypothyroidism present at birth or developing within first 2 years of postnatal life. Second point is, child is both physically and mentally retarded. Child is incapable of committing sins. That is one very important point. Next, myxedema. If you compare with the cretinism, the term myxedema connotes non-pitting edema due to accumulation of hydrophilic mucopolysaccharides in the ground substance of dermis and other tissues. Adult onset severe hypothyroidism. So myxedema observed in the adult. Then etiopathogenesis, that means causes. For cretinism, developmental anomalies, that is thyroid agenesis, ectopic thyroid, genetic defects in thyroid hormone synthesis, defect in iodine trapping, oxidation, iodination, coupling and thyroglobin synthesis. So these are all genetic defects. Then fetal exposure to iodides and antithyroid drugs. So iodides and antithyroid drugs exposure is also one of the cause for the cretinism. Then sporadic cretinism. Endemic cretinism in regions with endemic goiter due to dietary lack of iodine. Where the iodine deficiency is observed, there sporadic cretinism, endemic cretinism is observed. Then etiopathogenesis of myxedema, ablation of thyroid by surgery or Radiation, ablation means removing of thyroid gland by the surgery or radiation. Autoimmune thyroiditis, that is also called as a primary idiopathic myxedema. Endemic sporadic goiter. Thyroid cancer, prolonged administration of antithyroid drug, mild developmental anomalies, and dysharmonogenesis. Next, we are going to compare clinical features of the cretinism and myxedema. So, cretinism clinical features evident within few weeks to months of birth. Features of cretin: slow to thrive, poor feeding, constipation, dry scaly skin, hoarse cry, bradycardia. So these are the symptoms of the cretinism. Whereas myxedema: cold intolerance, mental and physical lethargy, constipation, slowing of speech, slowing of intellectual function, puffiness of face, loss of hair, altered texture of the skin. Then clinical picture of fully developed cretinism. So here fully developed cretinism: impaired skeletal growth, dwarfism, round face, narrow forehead, widely set eyes, flat and broad nose, big protuberant tongue, protuberant abdomen, that means abdomen will be enlarged, protuberant. Then characteristic laboratory findings for the cretinism is rise in thyroid stimulating hormone level, whereas decreased in T3 and T4 levels. Thyroiditis, next disease is thyroiditis. So this is an inflammation of thyroid gland due to non-infectious diseases, non-infectious causes. Classified based on onset and duration of disease. 3 types: acute thyroiditis, subacute thyroiditis, chronic thyroiditis. Acute thyroiditis, 3 causes: bacterial infection, that is staphylococcus and streptococcus infections, then fungal infection, aspergillus, histoplasma, pneumocystis, radiation injury. So these are the 3 causes for acute thyroiditis. Then subacute thyroiditis: subacute granulomatous thyroiditis, subacute lymphocytic thyroiditis, tuberculous thyroiditis. These are the 3 types of subacute thyroiditis. Chronic thyroiditis causes is mainly autoimmune thyroiditis and Riedel's thyroiditis, in which invasive fibrous thyroiditis, it is also called as a invasive fibrous thyroiditis. Next disease is Graves' disease. So Graves' disease is also called as a diffuse toxic goiter. Graves' disease is also called as a diffuse toxic goiter. Graves' disease is also known as a Bestow's disease, primary hyperplasia, hexophthalmic goiter, and diffuse toxic goiter. Characterized by triad of features, that means 3 features: hyperthyroidism, it is also called as a thyrotoxicosis, diffuse thyroid enlargement, ophthalmopathy, that means eyeball enlargement. So hyperthyroidism, diffuse thyroid enlargement, ophthalmopathy. The disease is more frequent between the age of 30 to 40 years. 5-fold increase among females, so it is more occurrence in the females. Etiopathogenesis of Graves' disease: autoimmune disease, it is an autoimmune disease. So autoimmune causes are genetic factor association, autoimmune disease association, autoantibodies. So first, genetic factor association: a familial occurrence has been observed associated with HLA-D3, CTLA-4, PTPN22, that is in bracket T cell regulatory genes. So these are all different genes involved in the genetic factor association. Then autoimmune disease association: Hashimoto thyroiditis and Graves' disease are the frequently present in same families along with the thyroiditis. Graves' disease and Hashimoto's thyroiditis, these 2 occur frequently. Then other factors for that which cause the thyroid Graves' disease is emotional stress and smoking. Then next, autoantibodies. So here 3 antibodies important for the Graves' disease: thyroid stimulating immunoglobulin TSI, thyroid growth stimulating immunoglobulin TGI, TSH stimulating THS binding immunoglobulin TBII. So 3 auto antibodies produced are TSI, TGI, TBII. So these 3 auto antibodies are responsible for the Graves' disease. These levels will affect the thyroid gland. Then clinical features: Thyrotoxicosis, clinical features of Graves' disease: thyrotoxicosis, ophthalmopathy, dermatopathy, ocular abnormalities. What are the ocular abnormalities? Means lid lag, upper lid retraction, stare, weakness of eye muscles, and proptosis. Then next disease is goiter, defined as thyroid enlargement caused by compensatory hyperplasia and hypertrophy of the follicular epithelium in response to thyroid hormone deficiency. So this is the definition of goiter. Then two morphologic forms of goiter are distinguished: diffuse goiter, nodular goiter. So diffuse goiter is also called as a simple non-toxic goiter or colloid goiter, nodular goiter, multinodular goiter, or adenomatous goiter. So nodular goiter is serious form of goiter than the diffuse goiter. Primary stage, second stage is nodular goiter. Then pathogenesis of goiter. Nodular goiter is generally regarded as end stage of long-standing simple goiter. Major etiologic factor for goiter is dietary lack of iodine. Deficient thyroid hormone production causes excessive thyroid stimulating hormone stimulation, which leads to hyperplasia of follicular epithelium of new thyroid follicles. Then simple goiter, cyclic hyperplastic stage followed by involution stage. Nodular goiter, repeated and prolonged changes of hyperplasia resulting in continued growth of thyroid tissue, while involuted areas undergo fibrosis. So here fibrosis is taking place in case of nodular goitis. No fibrosis in simple goiter. Up to involution stage it will be taking. Next, two forms. One is endemic goiter, sporadic goiter. Sporadic goiter is also called as non-endemic goiter. So first, endemic goiter, prevalence of goiter in a geographic area in more than 10% of the population is termed as endemic goiter. High mountains regions far from the sea where iodine content of drinking water and food is low, that is regions of Himalayas, Alps so these are hilly areas in the Himalayas where iodine deficiency will be there, so there goiter will be observed. Controlling measure for the endemic goiter is prophylactic use of iodized salt. So iodized salts should be supplied to the people to counteract prophylactically acting and preventing the goiter. Sporadic goiter, non-endemic goiter, less common than the endemic goiter. Then the etiology of sporadic goiter is unknown. So the cause for the sporadic goiter is still unknown. Coetrogens, substances which interfere with the synthesis of thyroid hormones. These are used in the treatment of hyperthyroidism. And certain food items such as cabbage, cauliflower, turnip, and cassava roots. So these four vegetables are preventing hyperthyroidism, decreasing the hyperthyroidism. Then causal influences are suboptimal iodine intake in conditions of increased demand as in puberty and pregnancy, genetic factors, dietary goitrogens, hereditary defect in thyroid hormone synthesis and transport, dyshormonogenesis, inborn error of iodine metabolism. Then difference between diffuse goiter and nodular goiter, very important for examination point of view. So here diffuse goiter, nodular goiter, first nomenclature. Simple diffuse goiter is simple goiter, hyperplastic goiter, non-toxic goiter, whereas nodular goiter is multinodular adenomatous goiter. Then second feature, etiology. Cause for the diffuse goiter is Graves' disease, thyroiditis, puberty, whereas for the nodular goiter, endemic thyroiditis, cancer. Then third one is pathogenesis, hyperplasia, involution, diffuse goiter, whereas for the nodular goiter, pathogenesis, repeated cycles of hyperplasia with growth and involution with fibrosis. Whereas composition of the thyroid gland in case of diffuse goiter, cellular rich, that means rich with cells, whereas nodular goiter, colloidal material will be more, so colloidal rich. Then gross anatomy of the diffuse goiter, moderate, symmetric, diffuse, enlargement, colloid filled follicles of then gelatinous, whereas nodular goiter, nodular asymmetric, that means imbalance between the two thyroid glands will not be there, that is asymmetric, hemorrhages, scarring, cystic change, calcification. Then in case of microscopical changes in diffuse goiter, hyperplastic phase, then followed by papillary infoldings, involution stage, then large colloidal filled follicles with flat epithelium. Whereas nodular goiter, incomplete encapsulation, nodularity, variable sized follicles, fibrous scarring, hemorrhages and calcification, cyst formation. Functional status: diffuse goiter, hyperthyroidism will be observed in case of diffuse goiter, and euthyroid, thyroid hormone synthesis is decreased, that is euthyroid. Whereas nodular goiter, hypothyroidism and euthyroid will be observed. Then you can see the different structures: goiter, enlargement of the thyroid gland, whereas here thyroid gland normal and goiter difference, enlarged thyroid gland. Then myxedema, hair, dry hair, coarse spares, lateral eyebrows thin, periorbital edema, puffy dull face with dry skin. Then you can see the cretin child, which is not able to commit sin, so it is mentally retarded. So you can see the manifestation: profound mental retardation, delayed motor development, coarse hair, protuberant abdomen, delayed closure of epiphytes, short stature, dwarfism. Cretinism is also considered dwarfism. Child will be small, height, it won't grow height. Then next, euthyroid and hyperthyroid, how it is supporting for the different goiter. You can see the diagram. Thank you. Read well. Subscribe to my channel. Thank you.